today to talk about his wife who experienced an intracerebral hemorrhagic.
Okay.
And I think we just want some education on her condition.
Sure.
Okay.
Hi, how you doing?
Hi.
How are you?
Hi.
Nice to meet you.
So the reason I came to you doctors today was just talking about my wife. She suffered what was called a hemorrhagic stroke, so it's affected her left side. And she's had this for about 7 months. She's on a two-wheel walker. But before that, she was an arborist, and we trained to climb Mount Everest.
Okay.
And also, she was a writer. So basically, that disease basically affected all those areas.
Okay.
Yeah. So basically, I just want to find out what I can do to help her and
Okay.
get some information.
For sure. So first we'll just go over what an intracerebral hemorrhagic is. So it's a type of stroke that occurs when a diseased blood vessel bursts, which allows the blood to leak out into the brain. And the brain cells surrounding the blood can be damaged due to the sudden increase in pressure. Now, did she have a history of hypertension, which is high blood pressure?
Yes, that's in her medical history.
That's good to know because that's one of the main causes of an ICH. Now, how does she appear to you when you guys are talking?
Her facial expressions are very dull, and it's basically one-sided, so I'm not really too sure how she's feeling or what she's saying.
Okay, so then she would appear very apathetic. And you said that her left side is affected. Does she feel pain? How does she describe that?
For on the left arm, she feels tingliness pretty much. She tries to tell me that.
Okay, so we refer to that as paresthesia.
Yeah.
And so when you ask her to walk towards you, how would you say that she performs that?
Well, like she's heavily dependent on her two-wheeled walker, so like the way she walks is very wobbly. Without it, like she wouldn't be able to pretty much.
Okay, so we would describe that maybe as like a mild praxic gait.
Oh, okay.
And lastly, how would you describe her speech?
Speech, it's very, I would say, all over the place. Holding conversation is tough because she could say one thing and then all of a sudden mention something else.
Okay, so we'll label that as Wernicke's aphasia.
Oh, okay. So then, what are some causes?
Well, you did mention that she had a history of hypertension, which actually is the #1 cause of ICH. Did she have any history of smoking at all in her past?
Yeah, she did smoke like 1 pack a day.
Okay, that definitely could be a contributing factor.
Oh, okay.
I want to go through a couple other factors that you could have noticed maybe happened in the past, or you're noticing some symptoms now, such as head trauma, any head trauma, certain drug usage, tumors that could have happened in the past, certain medications that are usually to treat any kind of heart disease or a stroke. Also bleeding disorders such as hemophilia, sickle cell, anemia, or an aneurysm.
Okay. So then, how does this happen?
Well, basically, ICH does occur in 3 phases.
Okay.
The first is the initial hemorrhage, so that is the blood that's escaping from the ruptured vessel. The second one is the hematoma expansion. So this is the collection of blood that is swelling inside the blood tissue. The third one is the perihematoma edema, and this is the fluid that's now collecting inside.
Okay.
So basically, it primarily depends on the latter of the two. The initial hemorrhage becomes evident when there's a rupture of the cerebral arteries. So basically, the intracranial pressure expands, but this happens over a period of days. So this isn't something that's immediate and not something that she would be able to feel basically with the initial onset.
Okay, so then how would she have been diagnosed?
So there are a number of ways that she could have been diagnosed. So through a CT scan, which is a non-invasive X-ray to see if there's any blood in the brain. An MRI, which is magnetic resonance imaging, which creates detailed images of organs and tissues within the body through the use of magnetic field and radio waves. An angiogram, which is an invasive procedure in which a contrast dye is injected into the bloodstream of blood vessels in the brain, and then X-ray images are taken. An ECG, which is a non-invasive procedure where electrodes are placed all over the chest, and this measures the electrical activity of the heart. And another way is using the Rosier scale, which is used to rule out stroke mimics, and it's a tool which uses clinical signs such as asymmetrical weakness, speech, and visual disturbances. And there are no signs or symptoms that reliably distinguish ICH from ischemic stroke. And then one more specialized test that is used to measure and assess physical impairment and disability in clients with stroke is the Chidoki-McMaster Stroke Assessment. And it's composed of 2 inventories, impairment inventory and activity inventory. And it measures clinically important changes in the client's functional ability. And each inventory is comprised of 7 stages. So 1 is being completely dependent and 7 being as completely independent. So maybe you can take a look at the scale here and then let me know what your wife is based on the numbers there.
I would say like for arm and hand, she's 3 to 2, and foot and leg, she's good. I'll say she's 4.
Okay, so her upper extremity is a lot more affected, more so than her lower extremity.
Okay, so then what are some of the indicators of ICH then?
Well, basically, you said it affected her frontal lobe.
Yeah.
And as you know, or I'm not sure if you know, the frontal lobe basically is our personality center. So you're going to be witnessing a lot of changes overall with how you interact with her. So things such as her problem solving is going to be affected, her judgment, decision making, emotions, and areas of speech, which we mentioned the word aphasia. You'll also start noticing more distinct clinical features such as her arm weakness, leg weakness, facial paresthesia, any visual disturbances. I mentioned facial weakness, apraxia, which we did mention before. Those are one of the big major key factors that I'm sure that you will start to notice.
Okay, so how is this going to affect her life?
Well, looking at everything that she's gone through, she's going to have difficulty brainstorming ideas. She will, with her left side, she won't be able to grasp objects that well because of her paresthesia. She'll have difficulty balancing on rough terrain.
Right.
And this will affect a lot of her participation.
Definitely. In terms of her continuing to write her fiction novel, that's going to be very difficult with the lack of her motor movement and also her judgment, her thinking, her creative side, because the brain is mostly affected, which is the command center of our nervous system. Also, her goal to climb Mount Everest, at this stage right now, it does seem highly unlikely, and for her to go back to her job as an arborist might not be able to accomplish at this time, unfortunately.
Okay, so are there any treatment options then?
Yes,
Definitely.
there are treatment options. So with medical treatment options, managing blood pressure to decrease the risk of more bleeding, but at the same time we want to make sure we're providing enough blood flow to the brain. Also, the biggest factor in the outcome of ICH is controlling intracranial pressure. So an intracranial pressure monitor is placed directly into the ventricles or within the brain to measure the pressure. A common method to control intracranial pressure is to remove the cerebrospinal fluid from the ventricles. So this is done by placing a ventricular catheter in the ventricles to drain the CSF fluid. And this gives more room for hematoma to expand without damaging the brain.
Okay, there's also surgical treatments as well. So there's the craniotomy and the stereotactic aspiration. So with the craniotomy, what you're doing is you're drilling a hole into the skull and you are exposing the skull and removing the clot entirely. With stereotactic aspiration, it's actually less invasive and is more preferred. What you're doing with this, you're going to use a syringe and you're going to suction out the contents of the blood clot instead of removing the clot entirely.
Oh, okay. Well, wow, thank you so much. I feel more informed, and hopefully we can move forward from here.
Yeah, it's great meeting with you today.
Absolutely.
It's good to meet you.
It's good to meet you too.